Hello, good evening, everybody. Uh, I would have liked to join all of you in a different situation, and unfortunately, uh, we have to meet in this particular uh, situation at in a like the situation is very fluid and things are not as they should be. Having said that, there is a lot of information about this coronavirus all over, and we are facing this information overload, and we did not want to add to this information overload. But at the same time, our goal was to make sure that all the information that is provided, that is the right information. And for that, we have Dr. Samir Jain with us. He is a local cardiologist. He is affiliated to various hospitals here in New Jersey. And he's here to mostly answer our questions. We are not going to have information overload by too many PowerPoints and stuff like that. He is going to explain a few things right in the beginning, and we are going to open it for the question and answers. With that, I have to just add a couple of things. If you look at your GoToWebinar panel, there are a couple of handouts that we have that you can use for your purpose, and share it with your club members and your friends and family. So here, without much further ado, let me hand it over to Dr. Samir Jain. Dr. Jain, the floor is all yours.
Thank you, Mahesh. Can you see me?
Not yet.
How about now?
Not really. Like if you look at your screen, there is a webcam button, and you have to start the webcam, I think.
Mahesh, can you share the meeting ID once again, please? 79, is that the 798-828?
Yeah, that is like sort of your ID is like sort of.
7. I'm not able to. So can you explain to me what's going wrong? I'm sorry. Listener. Just trying to get the thing going.
I think Samir, we can go without the video.
That's fine. Okay, that's not an issue at all. Okay. Good evening, everyone. Thank you, Mahesh Chitnis, for having me to speak to everyone this evening. I want to start with a couple of lines for introduction for myself and a couple of lines of disclaimer before we get into the actual discussion. If you're not able to hear me, or if you have any issues, please put it as a question on the chat, or just let Mahesh know, and Mahesh can help explain things. And I hope I'm clear and loud that everybody can hear me. I'm a cardiologist practicing in New Jersey. I'm board trained, board certified in internal medicine and in cardiology here in US. I've also done my medical school and internal medicine training in India, where I come from. And I've been a practicing cardiologist for last 15 years in New Jersey. You might be wondering why a cardiologist is speaking to you on coronavirus. My purpose of the talk is to educate people and take out some of the misconceptions. This is an infectious disease, and normally you would expect an infectious disease doctor to speak to you. But this is a new disease. None of us who went to medical school, when we went to medical school, the disease existed. So nobody is an expert. Everybody is an expert as good as they can train themselves to and keep up with what's going on with the latest developments on the virus. So I'm not an expert, but I've tried to educate myself to the best I could up until a few minutes ago. And my idea is to basically answer your doubts and questions. I'm sure you're bombarded with information, as Mahesh said, everywhere. So we'll start with a couple of small handouts. If you want to take a look at the handout, we'll start with what COVID-19 is. So Mahesh, the second handout on the handouts. If you are on computers, you can open up, or Mahesh can share the screen. The handout says need to know COVID-19.pdf. This basically tells you what COVID-19 is and basic information about what it is. As we all know, it is a viral infection. It is caused by a new virus called COVID-19. It originated in Wuhan, China, somewhere in November of last year. From there was epidemic of the Wuhan virus, in Wuhan of this coronavirus, initially in November, December. And from there, it has eventually spread around the world slowly in different parts of the world, and it has become a pandemic as defined by the WHO. Of course, it is here in US as well. It is spread now to pretty much all the continents across the globe. The time frame has been different. Some countries have been affected before us in US, and some countries are getting affected after us in US. So time frame is different, but pretty much the presentation is similar in a given population. How does it spread? It's a viral infection spread by droplets. What do you mean by droplets? Droplets means when you cough or you sneeze or you talk or you spit, small particles of your saliva along with your breath are exposed in the air, and they travel in the air and they go and in the air, which can be inhaled by other human beings, and that way the virus can be transmitted from one human being to the other. Or these droplets can fall into different surfaces, your computer screens, your desktops, your phones, your doorknobs, your your household items, dining tables, kitchens. And from there, if other person touches it, it can potentially transmit. But that is not the most important mode of transmission. The most important mode of transmission is droplets. So staying away from each other, keeping a distance between people, 6 feet distance as we call it, is the safest way of avoiding the virus. It can also be transmitted by fecal-oral route, which means if somebody's urine or feces contaminates somebody else's food or comes on the hand and then the hand goes in the mouth or nose, it can go from a fecal-oral transmission, which has been recently described, not again a very common mode. The most commonest mode, as we said before, is droplet infection. What are the symptoms? Symptoms are pretty much like any other viral illness, and that makes it very difficult to diagnose it. The symptoms are fever, cough, shortness of breath, muscle ache, body ache, and also sometimes some gastrointestinal symptoms like diarrhea, upset stomach, loss of appetite, things of that nature. We'll come to, I'm sure these questions will come up. How do you differentiate from flu and this and that? And we'll come to that a little later in the talk as the questions come up. Or if we want, we could discuss that at any point. The problem with Corona, why is this such a big deal? This is such a big deal because this is a completely new disease and nobody is immune to it. And that's what makes it so dangerous. So at this point, Mahesh, are we able to play that small? I have a 4-minute clip that's the only video you will see during this presentation. It's a 4-minute clip. I think it's well spent looking at that 4-minute. It's a talk given by the governor of Wuhan, who has firsthand experienced this whole pandemic evolve. And he's given a very powerful message, which I thought was pretty appropriate to play at this point in the webinar. So Mahesh, if you can please play that.
Yeah, let me do that.
And in the meanwhile, as he's trying to play this, if you have any questions, please feel free to put it in your question box on your webcam or put it in the chat.
Sober up. COVID-19 respects no national borders, no social bounds, no political systems, and no cultural values. It hits us just as hard. It levels the world. Facing the pandemic, it is not what happened matters. It is how we respond. For almost a month, it infected thousands in Wuhan in a day, and every hospital bed was occupied. Now, empty beds and closed wards in the city. How did China make it? It is nothing new, but it's worthy to know. According to an initial WHO report, an infected person appears to spread it to an average of 2.6 people. And after 10 generations of transmission, with each taking 5 or 6 days, that one initial case has spawned 3,500 in matters of days. And that is what the world is seeing. What China did is to break the cycle by human intervention. The scale unprecedented in history. Extreme, draconian, and aggressive. These are the words used to describe China's response. But now, people have come to terms with the new norm, lockdown. Some people say, isn't that a violation of individual rights? Actually, the balance between individual rights and public safety is always an ever-changing equation. After 9/11, all the airports in the world began to impose draconian safety checks on passengers, and people accepted it because we traded a little of our freedom for the greater good of the public. China imposed the largest and most draconian quarantine in history. Factories shut, public transport stopped, and people stayed indoors. By doing that, it flattened the curve. On one hand, China avoided many millions of cases and tens of thousands of deaths. On the other, it stretched out the time and made the hospitals restaffed and less strained. This is exactly what Europe and America should know. But public policy needs both ends to agree, the decision makers and the decision takers. Quarantine is indeed extreme and extremely restrictive. It needs the people in lockdown to be honest and cooperative. I think what the people of Wuhan did was exceptional. They had the courage, tenacity, and resilience to stay housebound for days, weeks, and months. Most view the quarantine as a civic duty, and that is why it worked. Public health methods are universal. They either work or they don't. We are all human beings. Our epidemiology is the same, but we have different economies, demographies, and sociologies. Facing a global pandemic, every nation needs a new contract signed between its politicians, businesses, and the public. Desperate times ask desperate measures. This is a desperate time, and we should not put politics ahead of public health, now more than ever. The new coronavirus has been claimed by ideologues. Donald Trump said it justified tighter border control. Bernie Sanders linked it to free healthcare. While in Singapore, every infection case is followed and dealt with. Bit by bit, every country is testing its methods through trial and error. Some paid a high price, and some set a high bar. We should all move ahead with humility. There is no decision without trade-offs, and most of all, there's nothing without skin in the game. And now, the whole world has learned, or is learning, to play.
Thank you, Mahesh. Can you hear me? Mahesh, can you hear me? Mahesh?
Yes, now I do.
And can you see me?
Now we can see you also.
Okay.
Yes.
So sorry about the webcam earlier. This is Dr. Jain again. So very powerful message, 4-minute video, very humbling, tells us no one. You can hear me? Hello?
Yes, we do.
Okay. So very humbling. It tells us nobody is
Yes,
immune.
we can hear you.
Yeah. Nobody is immune. Nobody can survive if they don't. No, everybody can survive, but nobody is completely immune to not getting this disease. So it's very important for us to be very humble and realize that we are all susceptible to this disease, and we all need to work in spite of what country we are in, or what our socioeconomic status is, or what our political affiliations are. It doesn't matter. We all need to come together to flatten this curve. Um, just elaborating a little bit, 1 minute on the flatten this curve concept. Flatten the curve, for people who already don't know it, means that we are trying to spread out the number of diseases and reduce the number of people who actually get ill or severely ill. If you see that curve that they showed, there was like a very steep rise, like the curve went straight up and then came down. What that means is a lot of people are getting sick at the same time, and as we go back to our communities, our hospitals have very limited number of beds, very limited number of ventilators. So for example, I'll give you an example of the town that I live in. I live in Toms River, New Jersey, which has a hospital has 28 ventilators, and there are 3 other hospitals in this community, in this county. There are a total of 70 ventilators in our county, and the population of the county is 1 million. So for 1 million people in the community, there's only about 70 ventilators available in the community. Imagine 500 people showing up in the hospital who are in respiratory failure and who need ventilators, and we have only 70 ventilators in the whole county. It's going to be hard. It's going to be very tough to take care of those people, and it's not going to be good. So what we're trying to do is, one, prevent 500 people presenting to the hospital in this example at all, make it 3 or 2 or 400 that we can handle, and also let them not present at the same time. Let people, if they are to have disease, first of all, they should not be, but if somebody is going to have problems, those people should have it spread over 2, 3, 4 months, so we have enough ventilators and enough ICU beds that we can take care of people who actually fall ill. So that's the flatten the curve concept. Just a couple of numbers also. 80% of the people who get, overall, about 40 to 70% of the population will get affected. That's the prediction across the world. Wherever the disease goes, 40 to 60, 70% of the people will actually get infected. Getting infected means they are exposed to the virus, and the virus goes inside their systems. 80% of the people who get infected will have a very minor disease like a flu and will recover completely. Will have some mild headache, mild body ache, fever, cough, will not be well for a few days, but then will have complete recovery and be normal as they are. That's 80% of us who might develop this disease. The remaining 20% are the ones who are going to have more trouble, of which about 14 to 15% are the ones who are actually going to need treatment, are going to need hospitalization, most likely in hospital bed, about 14 to 15%. And the remaining 5 to 6% are the ones who are actually going to get into trouble, going into respiratory failure or multi-organ failure, requiring ventilators to help them and requiring IV medications and things of that nature. And the best estimates of mortality are anywhere between 1 to 3%, depending on what data you look at and depending on how aggressive the treatment was and whether it was China or Italy or US. It's hard to predict, but the WHO gives a mortality rate of about 1%, between 1 and 3%. But to think of it at a population level, it's very high, even 1%. If 1% of the world's population is going to die because of this disease, it's really not acceptable for us as medical professional, and we as society. We should be trying to do everything that we can to prevent all those deaths and morbidities and mortality. And the only way we can do that at this time is is by prevention and preventing the number of people getting the infection and the disease by social isolation, by not interacting with each other, because we could be spreading the disease from one to the other while we are completely asymptomatic. I could be sitting around in front of you and appearing completely normal, but I don't know if I'm an asymptomatic carrier. I could be infecting other people around me, my patients, my family members, my friends, and same is true about anybody, your colleague, your employees, your customers, your teachers, your friends, your family. Anybody could be infecting you, or you could be infecting them. So that's the dangerous part of this virus. You could be asymptomatic, but you could be a carrier, spreading it through your droplets to people around you. That is why the most important thing about this is social distancing, which is about 6 feet of distance between two people, so that the droplets don't carry from one to the other, and multiple times hand washing with soap and water. Every time you cough or sneeze, every time you use the bathroom, every time you have your food, you need to wash your hands with soap and water for 20 seconds to prevent the transmission of disease. So I think, Mahesh, that's my introductory talk. I think I spoke more than I thought I will, but I think we'll open up for questions and questions that you may have, or questions that people on the webinar may have.
Thank you, Samir. If anyone of you who are attending this webinar, if you have any questions, and you want to use your your phone and talk to us, you can raise your hand, and I will unmute you. Or if you can type your questions, I can take the questions as they come in. Meanwhile, just one thing, Samir, when people are raising their hands, let me ask you a question myself. Sure. We are a service organization. Many of the people who are on this call are related to the Lions clubs. We are a service organization, and when we discussed with our local authorities, they asked us to keep off. Like they said, like, sort of, let the professional handle it. You don't get involved into any service at this moment because you might be carriers, or you might get affected yourself. So stay put. Let me have a plug. Our Global Action Team Constitutional Area Leader, PID Jerome Thompson, has set up a call for our Lions to discuss about how Lions can get involved. That call is on Monday at 8 o'clock Central Time. The thing is that my question is, when these organizations like ours are planning things to serve our communities, etc., how much longer that you think that we need to have this social isolation, social distancing, so that we can start planning on our service activities?
Very good question, Mahesh. Comes up all the time, and everybody brings it up. How long can we do this social distancing, and how long can the economy be like this? How long can the businesses be shut? As many world leaders have said, it's very difficult to put a time frame on it. The only thing that I would say in that regard is, we are not talking about 1 or 2 weeks here. We are talking about months here. We are talking of a minimum 6 to 8 weeks, 12 weeks, or more of this. Why? Because when do you say that you stop this social distancing? You stop the social distancing and all these measures that you put in place when your case load, the number of new cases detected every day, pretty much comes to a halt. Your curve from going like this becomes a totally flat curve. So the number of new cases becomes completely flat. They are not increasing incrementally. So normally, if you go into the statistics, it is supposed that one person will transmit the disease. If there were no measures in place, one person will transmit the disease to about 2.9 people, or three people each person. But by doing social isolation and putting all these measures in place, we will cut it down. By putting the measure in place, we're probably going to cut it down to about 2 or 2.2. And by keeping the social distancing ourselves and the whole population following it, and the strictest of the measures, you can get it down to 1-to-1. When it comes to 1-to-1, that is when you actually start releasing a little more liberality in your restrictions that you put on people. So I think we are looking at months. We are looking at minimum 3 months. We are looking till the summer. The schools that are not going to open this semester. The colleges and the schools are going to stay. Kids are going to stay put this semester, and they are all going to go into summer vacation and just start hopefully in the fall for the next year. So I think you have a good window of 2, 3, 4 months, if not more, to help people as an organization. And coming to the same point, I think an organization that like yours, which is so well spread all around the world, can do a lot of education, because still a lot of education is lacking. So just like you're doing the webinar now, you should be educating through each and every branch of yours, educating people and flattening the curve, because that's the most important thing. The more people are educated, the more distance they follow, social distancing, the less will be the number of care and less will be the life lost. And that's the biggest thing we can do for humanity, is prevent the loss of life. And that's what Lions is good at.
Sure. Thank you so much. We have a couple of hands raised. I'm going to unmute RG. RG, you are unmuted. You're self-muted right now. If you want to unmute you and ask your question.
Yeah, no, my question was just regarding the mask. Is it only because there's a shortage of masks for the healthcare workers? Is that the reason why we've been asked not to use it? Because I would think otherwise, just like a lot of other countries in the Southeast use it, and one, that it would just help avoiding touching our face, which we do so often without even realizing it. And in case somebody sneezes, coughs, at least there is no direct contact. Even if it's just a simple mask, at least there's no direct fluid touching you. So I'm not really sure why we've been asked not to wear them, in case we need to just, go finish our errands or go into work once a week, at least during those times.
So very good question. The conflict arises, and even at the policy level and the physician levels and the recommendation levels, there's conflicts. And I think you're absolutely right. I'm a big proponent of the mask being worn by people. Let me take a pause and explain this a little bit better. What you said is exactly right. If you have a mask on and somebody sneezes or coughs near you, then of course there is some protection. Again, the masks that we are talking about are regular masks, which are called surgical masks, which are available to general public. That's one kind of mask. The other kind of mask are the N95 masks. The N95 masks are the real deal. They are the one which actually prevent the transmission of virus. So there are recommendations on it, and for a reason. The recommendations are the N95 masks should only be worn by healthcare providers, nurses, doctors, EMTs, people who are in direct care of a person who is either positive or suspected to be in high risk positive, so that they are protected. Because if your healthcare worker, if your doctor or your nurse gets infected, he or she can be an asymptomatic carrier and give it to the 10 next patients that they see. So they need to be protected. So they need to wear N95 all the time when they're taking care of positives or suspected positives. General people, if there was no shortage in this world of the surgical masks, they should be wearing surgical masks. But the reality is there is a shortage of surgical masks in US and across the world at this point. Production is being increased, and hopefully this goes away. But what is the rationale? The rationale is what is the good way? A good way is, if you have a surgical mask, a regular mask, you should use it when you go out in a public place. Don't waste them. Don't use them inside your house. It's of no use, because you're exposed to your family members anyhow, and you can't protect yourself from your family members really, unless your family member is totally quarantining. So when you have to go into a public place, you have to go to a supermarket to do your grocery, yes, that may be a good time to use a mask. Your own mask, you could reuse, although it's not recommended. But if there is a shortage and you have to, you can. The advantages, as you rightly pointed out, of using a mask is, number one, biggest one to me is reminds you of not to touch your face, eyes, and nose and mouth. The transmission is because you have dirty hands and you're touching it to your nose or eyes without realizing it. And having a mask consciously reminds you. Now, remember, if you don't have a mask, you can just put a scarf on. You can put a, like a cloth on, a handkerchief on, or a scarf, a women's scarf or something on. Even that will remind you not to touch, and it will cover your face and mask. It will not prevent you from droplet. The only thing that can prevent you from droplet is a distance. So every time you go out in the public, you have to have a distance of 6 feet from people. Stay as far away as you can. So that is more important than the mask. If you have mask, you can use it, but don't hoard on it. When we are in shortage, our healthcare providers need it. Don't stack them up. You have a couple of masks or a few masks at your home, that's fine. If you're holding 100, 200 masks in your house, please go and donate it to your local hospital or local emergency room who need it more than you need it at this time. I hope that answers your question.
Thank you, Samir. We have one more question from Kamlesh. Kamlesh, I'm going to unmute you. Kamlesh, you're self-muted. I think Kamlesh is not here.
One other point I could clarify in the meanwhile while you're seeing the question.
Sure.
The clarification is on who is infectious and what is the incubation period and things of that nature. We didn't touch on it, but I think that's important to know. So when a person gets exposed to somebody else who has infection, and say the droplets come out and other person inhales it, the other person is not going to get sick right away. It's going to take anywhere from 5 to 7 to 9 days before he could show any symptoms. So for those 5 days, even that person who is infected may not know. 3 days, 5 days in different people may not know that he's infected, and he could be transmitting it to his family or colleagues or co-workers or whatever. That is the most scariest part of this virus. The second important part about this virus is everybody is naive. Nobody is immune in the world to this virus when it comes to a new society. So it takes time for everybody to develop immunity. So everybody is susceptible. And there are certain high-risk populations. So let's find out what the high-risk population is. The higher doesn't mean that anybody else should not follow the protocols and the social distancing, but people who are high risk, they need to be extra careful not exposing themselves to the public and going in social isolation and social distancing. So 3 or 4 groups of people. Number one are the elderly. So at about 60 years of age is where the mortality starts increasing dramatically. And at 80 years of age, the mortality is about 10%. It can even go up to 15%. So imagine how many old people are there that are with us. And if they are all exposed seriously and they are over 80, there's a 10% population mortality. So that's the biggest one, age. So anybody over 60 has to be more careful, over 80, extremely careful. Try not to go out of your house. Have other people do grocery for you and drop off at your doorsteps and you can pick it up. Don't mix with your grandchildren. Children are known to be asymptomatic. They can be carriers. So don't play with your grandchildren at this time. No matter how you love them, if you love them, they love you, you should be away. You should not be together. They could be carriers giving it to you because they go to schools, they go to parks, they mix with their friends. They could be carriers. So be very careful. Secondly are diabetics and high blood pressure patients. So diabetes and high blood pressure and lung diseases, underlying COPD, asthma, or congestive heart failure, people who have had heart attacks and stents put in and bypasses. So these, and kidney disease, people who are on dialysis, people who are immunocompromised, they are on steroids because of rheumatoid arthritis or whatever, or people who are on chemotherapy who have malignancies and cancers. This all forms a high risk population, and this is where the mortality is very high, 10%, 15%. Diabetes, hypertension, a little bit less, 7-8%, but still high. The second group of people who we are seeing very commonly, and more data is coming out, who are getting into trouble, not necessarily dying, but getting onto ventilators, are people in their 40s and 50s. Mean age of 50, people in the age of 40 to 55. You're not immortal. A lot of 50-year-olds are without any underlying health problems, are coming in with respiratory failure, fulminant disease. They might survive, they might not have the same mortality, but they are coming down with fulminant disease. One other thing, for some reason, the severe disease is twice as more common in men than women. So if you are a male and you have COPD or heart condition and you are over 60 or 70, you're talking of really high risk there. So be very careful, those people, and everybody practice social distancing.
All right, thank you. I'm going to unmute Ramakant. Ramakant, you are self-muted.
Hello, can you hear me?
Yes, I can hear you, Ramakant.
Hi. So my question is about that, a lot of discussion that, okay, this virus can stay in the air. Is this true, that it can stay in the air up to 8 hours?
So first of all the data at this point on all this virus, as you can imagine, this is a new virus, new disease that we are all learning, and every few hours the data is changing. So nobody knows for sure, but the concept of droplet infection, you can extrapolate from other viral illnesses. When somebody speaks, it can travel up to 6 feet. That's why the dictum of 6 feet. How long it can stay in the air is again debatable. It depends on a lot of factors, the wind and this and that. I don't think it stays in the air wandering around for 8 hours. So in other words, if somebody had a disease who came to a room and he left from the room and somebody else came after 2 hours in that room and went back, it's not necessarily that will dead. So typically what happens is the droplets, even though they are tiny, they are affected by the gravity. So anything that's in the air with gravity will slowly come down. And within a few minutes or an hour or two, those droplets would actually be falling on the ground and they wouldn't be in the air all the time. So the problem, even if somebody just crosses you, somebody who's positive, and you just walk by each other in a mall or in a grocery store, that's not enough to cause infection. Infection is only when there is a close contact. Close contact meaning less than 6 feet for more than a couple of minutes. Like a physician examining and listening to a chest of a patient. That is a close contact. A husband and wife sleeping together in a bed is a close contact. You holding a child in your lap is a close contact. You talking to a colleague one-on-one close by for 10-20 minutes is a close contact. Those are infections. Just walking by is probably not enough to cause an infection.
Okay, thank you.
You're welcome.
Thank you. I'm unmuting Jyoti. Jyoti, you are unmuted. You're self-muted now. Okay, let me take one more question. Anju, I'm unmuting you. You're also self-muted. Hello? Okay.
People can type the questions if they don't want to ask, or there is problem with their webcams. They can type the question in the chat box or raise their hand, and Mahesh can come to you.
Yeah, I can. Yeah, I can read that question.
Yeah, please
right
go
now
ahead.
we had. Okay. I'm going to read a question.
Yeah.
It is from Sunil. What precaution should be taken in a store checkout line?
So as any surface, store checkout line, grocery line, you go to a office, you go to a coffee shop, you go to wherever, any surface, the idea is you have to assume that it can be contaminated. The heavier the traffic, the more it is likely to be contaminated, like in a grocery store or a grocery cart that you're holding. So if you have wipes, Lysol wipes or any disinfectant wipes, you should carry them in a Ziploc bag, a couple of them. When you go to the store, you wipe the surfaces off that you're going to touch. Make sure while you are in the store, you make a conscious effort not to touch your face with that hand. When you are in the grocery line, try to keep 6 feet distance, at least 3 feet, if not 6, between the person ahead of you and behind you. When you are to the grocery store, try to pay by credit card, not by cash. Don't take cash in and out, because again, the cash has traveled different hands and it can pass from one to the other. The notes are known to be carrying germs. So paying by electronically, whatever, Google Pay, Apple Pay, credit card of your own, is a better idea than using cash. When you are done with this, you bring the grocery, you put it in your car, close your trunk, go back to your car, and before you're entering, you go back and start touching your steering. At that point, you take out your Purell or whatever disinfectant that you have, sanitize your hands. If you can wash your hands at some place, you do wash it or sanitize your hand, then sit in your car, come back home, unload your grocery, put it where you need to put it. If you can wipe off the top of the grocery, you do. If you can, that's fine. Just let it stay there for a while before you use it, if possible. And then go first, wash your hands with soap and water before you go back touching other things in your house. That should be the sequence of events when you go grocery shopping.
Good. Samir, we have several questions, and I would request everybody to sort of quickly ask the question and keep it as short as possible. Let me unmute Anu.
Okay, I'll try to be short as well.
You are self-muted.
No, I think I'm unmuted now. So first of all, thank you, Dr. Jain, for your time. As Mahesh said, I'll make it quick. So is there can the transmission also happen through blood? Because there is I see the commercials from Red Cross about blood shortage and asking for people to go donate blood. But if I don't know, if I have no symptoms and I think that I'm not carrier right now, should I consider donating blood, or can this disease also be transmitted through blood?
I know that's a very good question, and I'll be totally honest with you. I don't know the answer to that, but I can kind of think and give you some guidance on that, in the sense that the Red Cross requesting blood is not just for coronavirus patients; it's for other people who need blood too, which they always need, right? So what's happening because of this social isolation thing? People are not going out and they are not donating blood that they would normally donate. And while we are all concerned about coronavirus, there are people who are still dying from leukemia and other diseases and trauma where they need blood. So the requirement for blood still goes on. I believe if the Red Cross is asking you, they would have, I would imagine, at least in US, in this country, they would have procedures and protocols in place to check for it. There is an RNA virus testing, just like I'm pretty sure with the new development, they are running the test on a donated blood before it is used to give it to the recipient. So if you can donate a blood, I will still go ahead and encourage you to go and donate the blood. You are doing your morally right. It is their responsibility to check it before giving it to the donor, which I'm sure they have legislation in place and they are doing their moral due. So we have to give that credit to them, that they will check it before giving it to the needy person.
Okay, thank you.
You're welcome.
Samir, I'm going to read a couple of questions. I sort of go back to the audio questions.
Sure.
Deepak asks, the patients who are now corona-free, are they still contagious?
So the safety period, as we think it is as of now, is about 14 days from the time you develop infection. Most people who develop mild infection would transmit it for about 14 days, and after 14 days they would not be excreting virus in their droplets, and that's when their social isolation comes off. People who get severe infection going down to their lungs, who get hospitalized, who get on ventilators, are infectious for much longer, anywhere up to about a month time. So if somebody was hospitalized, then they need to be checked for this. There are testing available to check if you are contagious or not, but I think we are pretty short on that. Like in China, where they have more experience with it, before clearing the patient from the hospital, they are checking 2 consecutive samples of their RNA and their immunity. There are antibodies that can be checked, and there are ratios of antibodies that can be checked. So they're taking 2 consecutive day samples 24-hour apart. If they are negative, then they are clearing the patients to go out in the community without isolation. But most people who get infected who are at home, once you are infected or you're considered as high risk infected, you need 14 days of isolation before you can come out.
And we have a similar question to that from Kamlesh. Besides swab test, what are the other types of tests done to detect coronavirus?
So I'll come to the testing question, which is very important. And many of you might have read Los Angeles and New York just passed this today that they don't want routine testing. And this has been going on in medical community before. Because the virus is so rampantly spread right now, they say that everybody should not even be tested. If you have symptoms, assume you have a virus and go on self-isolation. Because if you don't do that, you will infect your family members, you'll infect your friends. So the first, at this point, if you were in a public place, you do public transportation, or you go to the city, or you've been in a work environment where there are many people, and you develop symptoms of fever, body ache, dry cough, then you need to go on self-isolation, irrespective of testing. Secondly, the testing most commonly done is the swab test. You do the swab from the mouth and the nose, and that's an RNA test, the RNA sequencing. It goes to the lab. Turnaround time varies. I have a patient in the hospital 3 days, the test is not back. It is improving. New tests are coming out. Apparently, there's a company which is manufacturing a send-out test now, which will be available in a few weeks. There are tests coming out which could give results in about 45 days. But as we speak, as of this moment, most tests are send-out tests, and the turnaround time to get the results back, if you are an inpatient, maybe 24 hours. If you're an outpatient, you're looking at about 2 to 3 days to get the results back. Until that time, you have to be in isolation. Mind well, the first test can be still negative and you can still have disease. So if you have symptoms and your test is negative, you still have to be on isolation, and a repeat test has to be done about after 24 to 48 hours. So that's where we stand.
Okay. James asks, any indication if those who get the disease and recover might later relapse?
Very important question, and unfortunately not solid answer from anybody. But this virus is so notorious and is such a, so to say, crazy virus that it mutates very fast. And there are already 2 mutations of the virus. When you develop an immunity to a virus, you develop antibodies to a particular genetic structure, RNA structure of the virus, and you develop antibodies against it. And that's what gets you protection if the virus comes back again. But if the virus mutates, then the new mutation, the same antibody may not be effective. So a second round of infection could come. We don't know. Nobody knows. Only time will tell. But this virus is unlike quite other viruses we have seen in the past, in that it is very virulent and very notorious for being mutating fast. That's why it's transmitting so fast as well. So we hope it doesn't happen. Let's hope and pray that that doesn't happen.
All right. A simple question. Is it a truth? Joanne asks, what is the truth that there is any vaccine having been developed?
So vaccine work is going on. There is no vaccine developed as of now. There is some study, they're saying they're trying to test something on humans in California, very small sample. They don't know for sure if it will work or not. First of all, it's a prolonged process, so it takes time. The simple answer is we don't have an answer. We don't have a vaccine. And the best estimates are the vaccines won't be available for minimum of 6 months, maybe. Before you develop a vaccine, you test it, and then it goes into commercial production and it's available for the masses. We are looking at about 6 months. Having said that, there's a very rapid growth and a lot of work being done. So I hope somebody comes up with something much faster. But as we speak right now, we are looking at minimum 6 months before we can get a vaccine.
Okay. Samir, Susan asks, how long do you think this virus will keep us in this state of limbo, where we are staying away from everyone else as best as we can?
So we kind of alluded to this earlier in the talk. The time frame is up in the air. Nobody can predict. The only thing that we can do is we can take a look at previous communities who started before us. So the virus started in China, spread around in neighboring countries, Iran and South Korea, and then spread into Italy and Europe, Italy primarily, and then spread into US. So we are all following each other. So we have to look at what's happening there to kind of predict and extrapolate as to what will happen here. So it started somewhere in November in Wuhan, and yesterday or day before yesterday was the first day that they had no new reported case. So considering the fact that they did the best they could and they put all the quarantine measures in place, it took them about 4 months from November to mid-March. They were taking about 4 months to try to get a level where it is under a decent control, and they're starting to open up some factories and close out some hospital wards. If we are able to do as good as them or better than them, then we were looking at less than 4 months. If we are not able to do as a community, as a country, if we are not able to do as good as them, we do worse than them, then we may be looking at more than 4 months. So as I said, a realistic expectation is give at least 8 weeks time before we can decide. And no, nothing what I say today may stand tomorrow true, because it's changing so rapidly. I'm giving you the information to date. I hope somebody develops a vaccine. I hope we have drugs which cure them. I hope something else happens that prevents it. But realistically, you're looking at about 8-10 weeks of these closures, or even getting worse.
Okay. Sumi asked, what is the best way to keep the mask in between uses?
Don't share your mask, number one. One person mask cannot be used by other person. No matter whether it's your family member, your husband, wife, kids. Don't share your mask with anybody. That's rule number one. In an ideal world, if you have a high risk exposure and you're using a mask, you have to destroy that mask. You have to throw that mask away, because that mask may have the virus, and now you are actually inhaling with that mask setting up here. So you are actually exposing you more and more. So if you really think you had a high risk exposure, you're wearing that mask, as soon as you come out of that area, you discard that mask. If you were just wearing it to protect yourself from touching your face, and you were in a grocery store, but you maintained all your distances and you did everything that I said, you take that mask, you put it in a Ziploc bag or a paper bag and keep it in your car. Don't bring it inside your house. Don't use it in your car all the time. Use it only when you're going in for another public event, when you're trying to prevent the same facial exposure. And how long can you use it? You should not be using it for too long. In other words, you can't carry on a mask for a week. Wear it keep it exclusively for your grocery use, or when you have to go out in the public, use it for 2, 3, 4 days and throw it off. Again, don't quote me on this. There is no guidelines on this. And we are trying to make the best sense of preventing ourselves, at the same time not compromising the public resources. Say in few weeks from now, masks are freely available on Amazon or wherever, and there is no shortage at all. in few weeks from now, then have mask and every time use it and discard it. That's the best way.
Thank you, Samir. There's a multi-question,
Okay.
the multiple questions in the questions by Anita.
Okay.
I think her first question was about wearing the mask, which you have already answered. Her second question is does the virus transfer through the grocery bag, plastic boxes, mails? Should we really use the gloves when we are handling them?
So technically, theoretically, yes, it can transmit through surfaces. Practically, very little, because again, any infection is dose dependent. Suppose somebody packed something on an Amazon box or whatever, and it got shipped out and came and gave it to you. The only time that surface would, so the virus in theory can survive up to 7 to 9 days on surfaces. It's a very, I gave a talk similar to this about 3 days ago, and I told in that talk the virus survives about 24 hours. And the data is changing so fast. In 3 days later, I am already speaking that it can survive about 7 to 9 days. It survives longer on metal and plastic, survives less on cardboard and paper, because these surfaces are more porous compared to a steel or plastic surfaces. So the biggest transmission sources are your phones and keys and doorknobs. The grocery bags, probably not, because there's only one other person touching it besides you, probably the person who bagged it. The delivery box, again, only one person's probably touching it. So the chances are less. If you want to be totally safe, again, anytime you take something and you keep it in, just wash your hands. Wash your hands with soap and water. Water is free, soap is plenty available. If you carry something, anything that you get inside your house, before you put that thing away, you get that thing in, open the box, wash your hands, clean it up, then pick up the item from the box, put it where you want to put it, go back, take the box, throw it away, come back, wash your hands. You're done. You're 100% safe if you do that. Transmission is very low with grocery bags.
And say again, one more question from Anita, that ibuprofen is like we have been asked to avoid ibuprofen. Is there any other medication to avoid?
Yes, that is a very good point, Anita, and I'm glad you brought it up. Very important, and I want everybody to pay attention to this. One of the reasons the mortality in Italy is very high compared to the mortality in some of the other countries like China and Asia, they think is because of the use of ibuprofen. Ibuprofen is an ibuprofen, and when I say ibuprofen, I mean all of these: Motrin, ibuprofen, Aleve, naproxen, diclofenac, all the non-steroidal anti-inflammatory drugs. Exclude a low-dose aspirin, 81 or 325 aspirin that people might be taking for their heart, that is fine. But high-dose aspirin, if you're taking 4 aspirins a day, or Motrin, or Aleve, or ibuprofen, they are all known to increase the morbidity and mortality of coronavirus infection. So if you have fever, body ache, symptoms of virus as it come along, the safest drug to use is Tylenol or paracetamol. It comes in different parts in the world. The same drug is known by Tylenol, paracetamol, crocin, or acetaminophen. That's the pharmacological name. People in US, Tylenol. People in India, crocin is the name to use. Safe drug, you can use it 500 milligrams up to 3 times or even up to 4 times a day, but I wouldn't go more than 3 times, generally speaking. Every about 8 hours, you can take as needed. Next question.
Okay. Again, you have alluded to that, but I'm going to still read it for reconfirming. Anil asked, how long the virus stays on different surfaces?
So I think we mentioned that paper and cardboard and things like that, much less. Steel and plastic, more. Latest data suggests that theoretically they can be on the surfaces for up to 7 to 9 days. Practically, if you wipe off the surface, wash your hands, you're pretty safe.
Okay. Okay. Again, there is another question by Anil. Are the pregnant women more vulnerable? Any extra precaution that they should be taking?
So the data on pregnant women is not out there much, unfortunately. But I would say they have to take extra precautions. Are they more vulnerable? Probably not. They're as vulnerable as everybody else. But everybody else can be asymptomatic carriers and be fine, or have mild disease and be fine. The pregnant woman might also be the same. They could be asymptomatic carrier and be fine, or mild disease and fine. But nobody knows what the effect of that is on the pregnancy and the fetus. And there's no way of knowing it. It's a new disease, so we don't know what it causes. So you have to assume at this point that it could have side effects. It could have. So if you're pregnant, I would recommend don't go grocery shopping. Let your husband or somebody else do it, and try to keep social distance from people.
Okay. Pratibha asks, what is the cost of testing coronavirus in the United States?
So the federal mandate is testing should be free, as per what Trump and the governors are saying. It should be covered by Medicare. It should be covered by all the insurances you have. It should be covered by Medicaid. If you don't have an insurance, the government should eventually pay for it. The commercially available kits I'm reading, I don't know for sure, I'm reading they're costing somewhere from $125 to $200. If you want to pay cash and get it, I don't know if you can. You can't get a testing done in this country unless you have so that's another thing. And as I said, routine testing should not be done.
Yeah. What I heard from Governor Phil Murphy today in his briefing to this morning, that if you go to any of the government facilities, if you are symptomatic, obviously, there is no cost involved. You can just go and
exactly,
get
that's
tested.
the point. No cost involved, but they may not necessarily test you, and you don't necessarily have to go. So my suggestion is, if somebody has symptoms or they think they have symptoms, the best thing would be to call your physician and discuss it out with him. Again, remember, a lot of physicians will give you a different opinion. What I'm giving you versus what your physician might give you is different, because the information is so changing dramatically every minute. But as we speak, the latest recommendations are, if you are mildly symptomatic and you really don't have much symptoms, you don't even need testing, just go on isolation. If you are a healthcare worker, or you are somebody who is exposed to a lot of people for whatever reason for your profession, and you are likely to infect a lot of people, then those are the people who are even asymptomatic should be tested to prevent transmission to other people. If you are very symptomatic, you have shortness of breath, you have high grade fevers, you're not doing well, then of course you need to be tested. Talk to your physician. Next question.
Okay. And a very good question from Amit, that you suggested Tylenol for fever. If somebody has cough, what medication that they should be taking?
So there is no harm in taking a cough medicine. You can take a cough syrup. You can take an allergy medicine. If you have a runny nose or something like that, you can take Allegra or Zyrtec or Cetirizine or Benadryl, depending on what symptoms you have. They are not shown to make anything worse. So that's basically symptomatic treatment. So if your main symptom is body ache, fever, myalgias, arthralgias, pain in the bones and muscles, then take Tylenol. If your main symptom is cough, you can take a cough syrup or cough lozenges. You can gargle with salt and water, salt and lukewarm water. You can take an anti-allergy medicines. They are all fine. That's not a problem.
Okay, good. Another question, Deepak asks, can coronavirus transmitted through water?
You see my hesitation, right? Because the data is so fast evolving. It is not described as a means of transportation. Let's put it this way. The WHO or the governing bodies, CDCs, are not describing water as a means of transmission. But data is evolving, we don't know. But generally drinking a tap water here is not a problem. When will it be a problem? When will water be a transmission issue? If there is fecal-oral transmission, which means imagine a scenario like India, maybe, where people are drinking river water and it is being contaminated by urine and feces of other people who upstream may have used it, where the hygiene conditions are not good. That could be a scenario where there is fecal-oral transmission and water could become a source of infection. In United States, I would imagine that probably is not a concern at this point, at least.
Okay. Santu Ghosh asks, self-quarantine can make the infected count to 0 in one day. Probably he wants to ask whether how long should be the self-quarantine to get down the infection.
The purpose of so we are mixing with the purpose of self-quarantine is not to treat you. Self-quarantine is to prevent others from getting infected from you. If you have the disease and your doctor tells you you need to go on self-quarantine, he's not doing that for your treatment. He's doing that to prevent your family members from getting affected. Your treatment is your body has to fight it. Everybody's own body has to fight the infection. And that's the way you're cured right now. So mild infections, the body will form antibody. You take Tylenol or cough syrup or whatever you need to be symptomatically good. Second very important aspect, which I didn't mention so far, you need to keep yourself very well hydrated. Drink a lot of fluids, just regular water, lemon juice, Gatorade, whatever you want. Keep yourself well hydrated. Hot tea if you like, that's all fine. You're all fine, you keep yourself hydrated. That will cure you. The quarantine is to prevent the people away from, to get infected. And again, the guidelines are same about 14 days time, you need to be on quarantine once you get affected. I wouldn't even call it, quarantine sounds like a very harsh word. And if you say somebody is in quarantine, we don't associate it with good feelings. I like to call it social distancing than quarantining. So if somebody is there, just say I'm socially distancing from people. If you say you're quarantining, people may not have the same attitude looking at you, or you may not have the same attitude looking at people, because we associated traditionally the word quarantine with people who really had bad disease or they really did something, which is very dangerous to everybody else. This is a very benign disease for most people. And, even though the word is quarantine, it's really social isolating. You're still staying in a house. By social isolation, you need to have what that means. That means you need to have a separate bedroom, if possible, separate bathroom, if possible, and not having communal dining, meaning not sitting on the same dining table and eating with your family. You need to be sitting separately in a room or on a chair 6 foot away from everybody else when you're having your dinner, and your plates should be separate from everybody. Your bathroom should be separate if possible. Next question.
Sure. One more question from Geeta. What are the symptoms and when should we decide to get tested?
So the symptoms, and I thought we would come up to it before, and I was waiting for a question like this to differentiate this from something like a flu or a common cold. So the symptoms are very similar to flu if you ever had, or a common cold or respiratory infection that most people have. So say somebody gets infected today, a typical course would be for 2 to 3 days, he may not have any symptom. And I'm just describing a typical course. At day 3 or something, you might start feeling a low-grade fever, like maybe you feel you're warm, you're not really fever, but you feel feverish, may develop a little bit of cough. Day 4, day 5, you may start developing a little bit of aching in your muscles or bones. The cough might get a little more. The coronavirus cough is typically more dry cough. It's typically not where you're bringing up a lot of phlegms initially. The fever is typically low grade initially. And day 4, day 5, you can start developing a little stomach symptoms. upset stomach, a little diarrhea, cramps in your belly, things of that nature. Most people from this point on will take a better course and start improving and get better and better. And as I said, about 20% will start deteriorating from day 7, day 8, where their cough gets worse, their fever gets worse, it becomes more high grade. They start developing altered mental status, or they become lethargic, their appetite goes down, blood pressure goes down, they're not eating, they just don't look well, they look sick. That's when the 20% are having more trouble. They have trouble breathing, they feel suffocation as if you can't catch a breath. So those are the typical symptoms. That differs from a regular flu or common cold. A flu, typically the onset is very instantaneous. You went to bed tonight, you were fine. Next day morning, you woke up and you have 101 fever, typically. Whereas a coronavirus, as I said, gradually grows up. The flu comes in instantly, lasts 3, 4, 5 days, and goes out instantly. Coronavirus goes up gradually, comes down gradually. So that's one difference. But let that difference be made and those be decided by your physician rather than you making your own decision. I just gave you some general guidelines. In this day and age where we are dealing with, if you're having symptoms like that, it may be a good idea to consult your physician. Most of the consultations have to be on telemedicine, just like we are talking now. If you have any symptoms, don't just walk into your physician's office. Call them ahead of time so they can put proper protection for their employees, themselves, and for you, and not infect other people. So call ahead before you walk into any walk-in, any ER. Don't go to the ER. Do not go to the ER. You increases your risk of infection. You're increasing risk for other people. Go to the ER only if you are in trouble. Only if you have trouble person and developing symptoms. Before ER, call your physician. Then go to the ER.
Yeah, we have 3-4 questions from Sumi, Kamlesh, and Geeta about the medication. We just heard on television that FDA has approved chloroquine as a remedy for corona. Is that true? And
so can you hear me?
Is it flat?
Okay. So the question is, what is the treatment? If I got you were breaking up a little bit, Mahesh, so I didn't get completely, but I understand the question is, what is the treatment and is chloroquine a good treatment and what are we doing for treatment? Something of that nature, right? Is that the question? Mahesh?
Yes, that's right.
Okay. So the treatment.
Yes, that's right.
Okay. So the treatment for most people, as I said, is supportive. 80% of the people, the treatment is the same, what I told you. If you have only a mild disease, nothing else is going to be done. Just take Tylenol and supportive care and you will recover. Those 20% who are developing the severe illness, that's when the other treatment comes into place. But that usually means that you are in the hospital or you are sick enough that your physician is giving you. The data came out only in the last 48 hours or 72 hours about these drugs, based on a very small study of only 36 patients and one other small study from France of a few patients. So while anything we do in medicine, the data comes out of double-blind controlled population study of thousands of people before the drug is approved. Because we are in such a dire state here and we are in such a panic mode across the world and we have nothing to do, we took a data of just 36 people, saying that somebody published from China, they published a data of 36 people who got chloroquine. Along with chloroquine, there is an antibiotic called azithromycin, a combination of two drugs. Chloroquine, which we normally use for malaria so far. The sister drug of chloroquine is hydroxychloroquine, which is actually even better and less side effects. So the real data is hydroxychloroquine plus azithromycin. Azithromycin is your Z-Pack that you commonly take, that anybody's physician in US commonly prescribes for upper respiratory infection. They'll just write a Z-Pack for you. The drug in that is azithromycin. It's an antibiotic. So the combination of hydrochloroquine plus azithromycin has been shown in a small study of 36 something people that it is effective in curing the coronavirus in severe people, curing or reducing the burden of the virus. So very promising. And because we have nothing else to catch on to, we all are latching onto it and we are going for it. All the guidelines now, all the hospitals, I go to the hospitals, I go to the ICUs, all the ICUs, we are using hydroxychloroquine and azithromycin as a first line drug to treat the sick patients. So yes, the answer is yes. That's what we're using it now. Time will tell how effective it is and whether maybe it is very effective. Now there, I already see social media posts of even my colleagues posting that should we use hydroxychloroquine as a prophylaxis, a chloroquine as a prophylaxis. Many of us use chloroquine as a prophylaxis when we travel to India or all these countries where malaria is rampant, and we use chloroquine tablets as prevention. So people are extrapolating and going on a fast forward mode saying that, oh, maybe this can be used for prophylaxis. I don't want to give you false information. That's my job here because there's so much data available to you. As of now, it is not recommended for prophylaxis. Maybe tomorrow it will be, I don't know. As of today, it is not. As of today, it is recommended for treatment of only for people who are severely ill, requiring hospitalization by your physician. So that's the answer. Yes. And I hope it really works, because if we have this, then we really have a cure or a good treatment plan and our mortality will really go down.
The another question is, I have a skin irritation and headache. Is it possible that I have coronavirus?
Mahesh, could you repeat your question? You were breaking up. I couldn't hear you.
Yes. The viewer asks, he has a skin irritation and headache. Is that a sign of coronavirus?
I would say no. Skin irritation and headache just like that, no. But you'll have to wait and see how you're doing. If you were having headaches even before, and this is the same headache that you had from before, it probably is that. Skin irritation and headache are not described as the first symptoms of coronavirus. But if you think that you had a high risk exposure, or you were out and you're concerned, or you had an air travel in the last few days, anything of that nature, if you have anything high risk exposure situations, it doesn't harm to go into a self isolation for 1 or 2 days. Not just social distance from your family for a day or two and see how you progress. If your symptoms go away, you have no other symptoms in a couple of days, you're feeling much better, you're probably fine. And if symptoms start to get worse or you start developing fever, then of course you need to be more concerned. Next.
Yes. How do you protect diabetic and non-diabetic patients? What precaution that they should be taking?
So as I said, as compared to general
Samir,
population,
could you hear me?
yes, I could hear you. As compared to the general population, diabetics are at a higher risk. So they need extra precaution. What extra precaution? Precautions are the same. Social isolation, hand washing, not touching your face, trying to stay away, trying to avoid anything. At this day and age, unless you really are in an essential job, nobody should really be going to commute, going to office. You should be working from home, or you should not be working if that's a possibility, or you should be talking to your employer about what else can be done. Um, Diabetics especially, you should be more careful, because it's not that you are more likely to get, you are same likely to get as everybody else. The problem is you are more likely to get severe infection compared to a person who's not diabetic. So the precautions remain the same: social isolation, keep distance, wash your hands, wear a mask if you're going out. Next question. Mahesh, do we have another question?
Which okay, yeah, Yeah, I'm just screening through because like many of the questions that you have already
Yes.
answered. So if uh, okay, I have a neighbor who goes to dialysis. What precaution should that patient take?
Wow, that's a tough one. That's really tough. Um, as I said, the people with kidney failure, people on dialysis are high risk. Of course, they cannot avoid not going to dialysis because that's essential for them. So they have to be on extreme precaution. Um, they have to be on extreme precaution, and their dialysis center has to be on extreme precaution. So they should be wearing a mask all the time when they go home. This is a kind of a patient who should really be wearing a surgical mask every time he goes to dialysis and he comes back. The number of people handling that person should be minimum. So handling meaning people transferring with them, people going with them, people coming back, and in the dialysis center, the nurses or technician touching them should be kept to the absolute minimum possible. Um, you should try and keep your face on the other side when somebody comes, and the people taking care of you should also be wearing masks to prevent transmission to you. You should be very, very thorough in washing your hands, desanitizing them, and not touching your face for this. Uh, that's all you can do. But you have to have your dialysis, otherwise, it will be more trouble. Next question.
Varsha asks, how would improve your immunity?
How would you grow your immunity? Is that the question?
Yeah, improve your immunity. Yes. Yes, it is.
Okay. So improving an immunity is not an instant solution. Okay, I want my immunity tomorrow more, so I take tablets and my immunity will be more tomorrow. That's not how it happens. Immunity goes with your general health. The healthier you are, the healthier is your immunity. So what you have to do healthy things. What do you mean by healthy things? You have to be exercising. Even though you're on self-isolation or quarantining, you still should be exercising. You can go for a walk, keep social distance, go alone, don't go with your partner. You can do backyard work, you can do elliptical, treadmill, you bicycling, whatever you can. Do some physical exercise, increase your respiratory rate, do breathing exercises. Pranayam, meditation, breathing exercises are very good. The more you increase your lung capacity, the better it is chance for the virus, your lungs to fight the virus. The more you're pulling out secretions. So doing deep breathing exercises, pranayam and meditation is good in this regard. That will improve your lung capacity, and lungs would increase your immunity. There is some data, some again, equivocal data to suggest that taking vitamin C and multivitamin will help your immunity. If you want to take it, there is no harm. It may or may not benefit, but taking vitamin C tablet every day and a multivitamin tablet every day is probably a good idea. And doing exercises, keeping active, even though you're on self-isolation, keep active. Don't go sedentary. Don't just become a couch potato, because that's gonna be not good for you. Next question.
Steve asks, it is NyQuil safe to take?
I'm sorry, repeat that.
NyQuil,
Is
is NyQuil safe medication to take?
I believe so. NyQuil should be okay. NyQuil has acetaminophen, which is the same drug as Tylenol. And then it has an anti-allergic, antihistaminic in it. So it should be okay. But read the label of anything that you buy over the counter and make sure there is no ibuprofen or Motrin or Aleve or uh, one of the NSAIDs, naproxen, things like that in it. I believe, to the best of, I have not read the label of NyQuil in a while, but I believe to the best of my knowledge there is no ibuprofen in it. but please check the label. If there is no ibuprofen, then you should be fine. Next.
Okay, this question from tropical Guam. Sumi asks, is swimming in swimming pool and ocean is safe?
At this time, swimming pool is not safe. Especially any public swimming pool is not safe. Your own swimming pool, probably not also, because if your family members are going in that swimming pool, or the same is true about any sauna or hot tub or steam room, these are where the aerosols are, the droplets are in a closed space for a longer time, and they keep circulating over and over again. So it increases your risk of infection very, very high. So sauna, hot tub, absolute no. Swimming pool, no, unless you are the only one person going in that swimming pool, which I don't think happens. So no, they are very high risk for infection transfer. Next.
Okay, this is a interesting question. What is in vitro? If the taste of cure is successful in vitro, do we know that we have a cure?
No, you will never know you have a cure till what you say. For example, for antibiotics, when we have a new antibiotic, how do we know it will cure? We take the bacteria, we put it in a medium, we grow that bacteria, we take the drug, we put it in that petri dish or wherever and see if it prevents the growth. That's the first step we do. Then we extrapolate, we start animal studies, and we do that in animals. We give the bacteria to the animal, develop the disease, then give them the antibiotic, say it cures, see what the side effects are. Then we give it to humans in small numbers and try it out. Small numbers, if tests come out good, then we give it in a bigger population. In a bigger population, double blind randomized trial, we run, we get the results. Then we say, okay, FDA is satisfied, the drug works, the side effect is not much, and it is approved for everybody. That's how a normal drug comes into existence before it comes to us. In this case, we are just bypassing all these steps. Just 36 people were randomly given chloroquine and azithromycin and given, but they were good data. So we have nothing else to hang on to right now. So we are using that data and we are extrapolating it to give it to everybody else because we have nothing else better. And we are hoping it's going to work. So there are lots of ifs and buts that we have not answered. Any drug that works in vitro, it's not necessarily that it will work in vivo, that it will work inside your body. So adequate precautions and testings have to be done before the drug comes out. Next question.
Again, Sumi's follow-up question: is it safe to swim in the ocean?
Ocean swimming, probably safe. Again, if you're going on a beach, may not be safe if the beach is crowded. I hope nobody's going on beach, and because it's a public place. Now you should not be going on a public place to do this. I don't think you should be going into an ocean to swim at this point because you never know who came in the ocean before you, who went after, how much is the contamination. The problem is you don't want any liquid or anything that could potentially be contaminated by a virus going into your body because we don't know. I haven't come across myself of anybody reporting a transmission from seawater, but does that mean you can do it? I don't know. I think it's better avoided at this point till we have more information. Next question.
Can we? Is it safe to go to a dentist?
Question is, why are you going? Anything that we do, ask a risk and assess in your mind the risk and benefit. If you're going only for a routine cleaning, it can wait a few weeks. You know, why expose yourself or the dentist to anything that's usual? I'm telling you something, I'm a cardiologist. I see on an average about 30 patients every day in my office. before all this started. For the last 1 week, I've seen 2 patients in my office in the entire week. Only 2 patients in my office. And normally I see 30 patients every day. Why? Because I don't want to put anybody at risk. I may be a carrier. My staff member may be a carrier. Why do I want to put my patient at risk? I'm available to do a webcam. I can do a teleconference visit with you, and if you have questions, I can answer it. Only if I think the 2 patients that I brought in because I really needed to check their ECG or check them for heart failure, and if I didn't do that, they would have ended up in the hospital, and I wanted to prevent their hospital visit. I've seen multiple patients, but I'm seeing them on webcam. So the question is, whatever you're trying to do, how much is the benefit of that versus the risk that you're taking? If you're going to a dentist for a routine cleaning, just avoid it for 4 weeks, 6 weeks till we settle down with all this. If you have an infected tooth that needs to be pulled out, then you have to go and get it pulled out. So that's the answer. You make that decision based on why you're going to the dentist for. Next.
Then there are several questions about high blood pressure. The people with high blood pressure, precautions they should take, and should they continue with their medication?
So high blood pressure, like diabetes, is also described more in frequency in people who have severe disease. Now, there is a little bit of caveat here, because most people who have severe disease are older, so they are more likely to have high blood pressure. More than 60% of the population in this country over the age of 50 or 60 have high blood pressure. 2 in 3 Americans have high blood pressure. So by that definition, everybody is high risk. I mean, 2 in 3 Americans are high risk. Adult 2 in 3 Americans over the age of whatever, 50 or 60. I don't think that high blood pressure in itself is that big a risk. It is just more prevalent in the community. So if you do any study of high risk of people who have severe disease, naturally high blood pressure will come up because it was prevalent to begin with. I don't think, just personally thinking, logically thinking, again, very little data, logically thinking, just because you have high blood pressure and you're on one medicine and you're otherwise healthy, doesn't put you at higher risk of having problem, in my opinion. Again, my personal opinion. But yes, it is seen more common than other people, so take more precautions. Same precautions, whatever your disease is, the precautions remain the same. And at this time, you're not recommended to change your medicines, any medicine, including, there is some data about ACE inhibitors and ARBs that you may have seen on social media or web, but the final recommendation is, at this time, we are not recommending anybody to change their blood pressure medicines. Next question.
One question from Urmil, that what is the obstacle or barrier in testing more people per day?
You broke off, Mahesh. I couldn't hear the question fully. Could you please repeat?
What is the obstacle or barrier in increasing the number of tests every day?
So the barrier is obviously availability. Nobody anticipated this kind of volumes. So if if there was a disease that was prevalent previously, we would have testing kits lying around here and there, and people were already doing production of it. So they only have to increase their scale of production. Now you have a completely new disease. You need a completely new RNA sequence. You need a completely new laboratory method to develop it. So it takes time for that to be developed in the labs, and not just develop, to increase the production to a mass scale. Now we are talking of needing these tests in millions within the next few weeks. And our production capacity just about a week ago was not even in thousands. So to scale from thousands to millions, new labs to start making it takes time, but I'm very hopeful that within a week's time, the test availability would be much better, and most people should be able to get the testing within about a week's time. That's my realistic hope. Next question.
Okay, a few quick questions. One is there any risk in eating the takeout food?
Is there any risk in eating takeout food? One good part is anything that is cooked mostly does not carry organisms. So if it is something that is cooked, uh, fried, boiled, microwaved, whatever, most of that will kill most of the organisms. Hopefully, it will also kill coronavirus, and there is very, very little risk. The only risk is if the the restaurant owner or the chef or whoever made it or packed it, if that guy was infected and he, knowingly, unknowingly sneezed or coughed and it went into your food and then you're eating that food, that might increase your risk. But again, in a food, the food actually, if it's going in your mouth and going down into your stomach, the risk is very low. I cannot say it is non-existent completely. I mean, in an ideal world, you cook at home and eat, but your wives are not going to be happy for months if they're just going to have to be cooking every day. So that's all I can say. Next.
Is the summer, is the increased temperature reduce the infections?
Honest answer is nobody knows. It is a speculation and a hope at best. No data. The bacteria get killed. Some of the viruses get killed. Does coronavirus get killed on the surfaces? The surface transmission might go less, but human to human transmission will still continue. The summer may reduce transmission from using objects and sharing objects and things like that, but droplet infection probably would still be affected unless we do social isolation. But that's the best answer I can give. Next.
Okay, what is the lifespan of coronavirus?
I don't know. Honestly, I don't know. Typically, the viruses have a small lifespan compared to bacteria. But the problem is their multiplication is much, much multifold than bacteria. So an individual virus cell will only live for 1 or 2 or 3 days at the most, generally speaking. But within those 1 or 2 or 3 days, it would have produced multiples 10, 20, 100, 500, 1,000 million more virus particles. And they are all produced at different time frames. So they keep leaving each other. So the total population keeps increasing unless the body starts fighting. But when the immunity comes into picture, when the body starts developing immunity, it starts affecting that replication of viruses. And then that's when their count starts going down. So a typical viral illness, that's why lasts very small, 3, 4, 5 days. Coronavirus, we are saying up to 14 days, 10 to 14 days, unless it is very severe. So the lifespan of a virus particle, technically, I don't know, but probably should be around 24, 48 hours or something of that nature. Next.
Okay.
So are we done, Mahesh, or we have more questions?
Is there any precautionary medication available?
No, no precautionary medication at this time. No recommended.
We have a few more questions. We are actually about time, but let's take a few questions.
Okay, we'll take a few questions, no problem. So as of now, no precautionary medications. There is some rumor and some ideas in people's mind to try and use chloroquine or hydroxychloroquine for prevention. These are again rumors and ideas without any scientific basis to it. Recommendation? No, nothing. Next.
The one specific medication that this person has specified is Larigio DS.
So Larigo is Larigo is a brand name of chloroquine, which is the same medicine that we talked about. Chloroquine or its derivative hydroxychloroquine are the only drugs that are being used. It comes by a brand name of Lariago in many countries. So yes, that is the medicine that is being used for severe cases. Next.
What are the chances that COVID-19 will mutate again?
You take a guess. I have no idea.
Lloyd asks.
I don't have an idea of whether it's likely to mutate or not.
Okay.
Nobody.
Okay. If somebody doesn't have fever, would they still have COVID-19?
Yes, very much possible. As I said, asymptomatic carriers are there; they can have it. There will be people when this is all done. Say in 6 weeks, 8 weeks, we are all done with all this, and we are all back to normal life, what we call normal. There will be many people who will say, "Oh, I never had infection. I had no problem." Many young adults, many children, it doesn't affect children much. They'll say, "I never have a problem," but we'll never know they're just not infected, or they were infected but never became symptomatic, unless we do testing on everybody to see if they have antibodies or not. Or we wait till a second wave comes and then see whether they fall ill or not. So yes, it's possible you can have infection and no fever. It's very much possible. So you have to assume everybody is carrying the virus at this point till we come to a flat curve. Next, please.
Okay. How do you differentiate between flu and corona?
So as I said, the symptoms are a little different. I mentioned that before. Corona is a very gradual onset illness. Flu is a very rapid onset illness. Flu has high grade fever. Corona has low grade fever. Flu has usually more of headaches and severe body aches, which corona doesn't have in the earlier phase. And the cough is more with sputum production, phlegm production with flu compared to corona. But again, these are very subtle features differentiating them. The final is for a respiratory swab. If you do a swab, you can do a flu swab and a corona swab, and generally they don't coexist. That's a good part. They don't infect at the same time. So you could do a swab, and flu testing is very common in any doctor's office, any walk-in clinic. They can check you for flu and the results can be back instantly, like within hours, and you can find out. So if you are in doubt, it's good to go to talk to your doctor, get a flu testing done. If flu panel is negative, then more likely to have corona. If flu panel is positive, then you're more likely have flu and you don't have corona. So at least at that time. But you can recover from flu, and a week later somebody can be unfortunate enough to get corona afterwards. So that's where you stand with flu and corona. Next.
Okay, I think those are the questions that we had. I'm sorry I couldn't get to the audio questions because there were so many questions coming in fast and furious on my screen. But there are 2 points that are made by our listeners today. One is from Anjupuri, that there is a misconception that the young and healthy will not get the virus, and they are still getting involved into sports and things like that. and they are not practicing social distancing, but they are getting affected. There are examples where there are high performing athletes on NBA and several other sports. They are infected. So Anju is stressing that the
Yes.
young and
Just
healthy also should know that they
Yeah,
need
just
to
to stress that for a minute,
do the social distancing.
nobody, yeah, nobody is immune. No matter what age you are, you will get infected. You could get infected. And just because you're young and healthy, if you really love your parents, if you really love your friends and your grandparents, do it for them, because otherwise you could be the reason your grandparents or your parents end up in the hospital because you transmitted to them, because you didn't listen to them. So emphasize that point to your kids, that they should not be going out with your friends just because schools are off. They should not be hanging out. Emphasize to them that they cannot hang out. They have to keep social distance for the sake of their family and friends.
And one more suggestion that came from Joanne Carr, that there was all these rumors on social media that were going around that you get virus because of your animals, and people are giving up their animals, and this is very unsettling for Joanne. She wanted to make this point that the your pets in your home don't spread the
Yeah, the
virus.
transmission is totally human
Any
to
comments
human.
on that, Samir?
Yeah, the transmission is not animal to human. So your pets don't give it to you. You don't give it to your pets that we know of, unless there is fecal-oral transmission, which is very rare. So just practice good hygiene, hand hygiene. You're fine. Your pet is fine. If your dog licks you, he's not going to give you corona. Don't worry about it. So you should be same compassionate to your pets as you have been before the corona existed.
All right, Dr. Samir, there is a lot of appreciation coming your way. Stephanie says that thank you for your time, Dr. Jain. This helped decrease my worries and provide important information to help me to take better care of patients in the emergency department. So with that, Dr. Samir, thank you for your time.
I
Thank you
want to
for all
thank
you are doing for our communities. I'm aware.
Yeah, Mahesh, thank you for giving me the opportunity to spread the education. My whole aim and goal of this whole conference was to educate people, take out misconceptions, give common, simple answers. You can find every data that you want on the web right now. It's all over. The idea is just to spread the awareness and talk about practical points that we have in mind. And I want everybody who attended this to spread it to as many people as they can, so we can all together work to flatten that curve. So that's my hope with all this. And I'm available if anybody has any other forum that they interested me. Please contact Mahesh, and Mahesh, if you have any other opportunity where I can help, I'll be glad to do that. Thank you for having me. Thank you. Have a good night, everyone.
Sure. Thank you so much. And when I was about to close, I got a question from one of the lions
Okay.
who says, "What lion should do in this crucial movement?" Mohammed, there is that PID Jerome Thompson is hosting on Monday evening at 8 o'clock Central Time. That is 9 o'clock Eastern Time. I will send you all the lions who are on this call. I'll send you the link for the webinar. And if you want to join there, share your ideas and listen to our leadership and finding out how to serve. That would be
Mahesh,
a
if
good
you
start.
want me to,
So with that, thank you, Samir,
Mahesh,
again for helping
if
us
you
with
want
this.
me to speak to more lions, I will be available. I can do that, because I'm very passionate about spreading this message to people around. So if you feel at any point you need my help, don't hesitate to reach out. Thank you.
Sure, let's do that. Okay, thank you so much, everybody, for joining us tonight. and have a very, very good night and stay safe. Thank you.
Stay safe. Thank you.